Good morning, everyone. Today, your topic is chemotherapy of tuberculosis for second year pharmacology. And what is tuberculosis? The introduction part. Tuberculosis is a chronic granulomatous disease caused by Mycobacterium tuberculosis, which is commonly affect the lungs. M. tuberculosis organisms are also called as tubercle bacilli, and global emergency tuberculosis kill 5,000 people a day worldwide. And these are the type of TB, tuberculosis: pulmonary tuberculosis, avian tuberculosis, bovine tuberculosis, or miliary tuberculosis. And the characteristics of tuberculosis include highly aerobic gram positive, infect lungs, divide every 15 to 20 hours, and very resistant to many disinfectant, and spread through air by inhalation. As you can see here, this tuberculosis bacteria are spreading one person to another person via inhalation. And here you can see the Mycobacterium tuberculosis in human body part. And most common site to TB disease. TB germs are most commonly found in the lungs, but sometimes they can move to another part also. And the part affected by the TB are lungs, pleura, CNS, liver and spleen, lymphatic system, genitourinary system, bones and joint, and disseminated. And mode of transmission, you can see here, Mycobacterium tuberculosis may expelled when an infectious person coughing without covering the mouth, and cough and sneezes, speak, sing and laugh in crowded places or in poor ventilated areas, and splitting everywhere. Okay. And these are the sign and symptom. The symptom may vary depending upon what type of tuberculosis you can have. And the sign and symptom include fever, chill, night sweat, loss of appetite, weight loss and fatigue, coughing with blood, chest pain, weight loss and tiredness. And the treatment: most TB is curable, but 4 or more drugs required for the simplest regimen. 6 to 9 or more months of treatment required, or a person must be isolated until non-infectious. And the classification over here you can see based on chemical moiety of the drugs. And the first is salicylic acid derivatives, and second one is pyridine derivative, and third one is pyrazine derivative, and the fourth one is ethylene diamino butanol derivative, and the fifth one is antibiotic. The WHO divide the treatment option into two subtypes: first line treatment or second line treatment. So the drugs which are comes in the category of first line treatment are rifampicin, isoniazid, pyrazinamide, ethambutol and streptomycin, and the most important drugs. And the second line drugs are fluoroquinolones, amikacin, cyclosporin, ethionamide, para-amino, salicylic acid and capreomycin. Some are the newer drugs in the market for the treatment of tuberculosis are ciprofloxacin, ofloxacin, clarithromycin, azithromycin and rifampicin. Here you can see the first drug we can discuss are rifampicin. Rifampicin is a semi-synthetic rifampicin. mycin made from rifamycin B isolated from the Streptomyces mediterrane. And mechanism of action, you can see the first line antibiotic drug rifampicin interfere with the RNA transcription over here. You can see in M tuberculosis, here you can see the mRNA, and here you can see the entering of rifampicin into the dRNA chromosomal DNA, which is responsible for the transcription of mRNA. And here you can see the rifampicin inhibit the transcription of mRNA to the cell cytoplasm. Rifampicin bind to the B subunit of D-dependent RNA polymerase complex and inhibits the transcription of messenger RNA. The mRNA transcripts are essential requirement for protein synthesis, so they are useful in treating tuberculosis, leprosy, mycobacterium avium complex infection, and streptostaphylococcus infection. And here you can see the adverse effect, hepatotoxic effect like hepatitis and liver failure, respiratory effect, that is breathlessness, abdominal nausea, vomiting, abdominal cramps, and flu-like symptom with chills, fever, and headache. The dose of rifampicin is 10 mg per kg, and the therapeutic use of rifampicin, it is also used in the treatment of leprosy, infection like endocarditis, inflammation of membrane lining of the heart, osteomyelitis, inflammation of bones, used for the combination therapy with dapsone for leprosy, excellent drug for pneumonia. And the next drug is isoniazid. It is tuberculocidal, and here you can see structure of isoniazid, chemical structure over here. First line medication of treatment of tuberculosis, available in the form of tablet, syrup, and injectable form, and this is effective against actively growing bacteria. And here you can see the mode of action. The mode of action of isoniazid in this inhibits the biosynthesis of mycolic acid, which are essential constituent of mycobacterium cell wall. Here you can see the cell wall over here, and there are the synthesis of mycolic acid, and isoniazid inhibit the synthesis of mycolic acid, and the dose is 5 mg per kg. And the adverse effect are nausea, vomiting, jaundice, and loss of appetite, peripheral neuropathy, fever, skin rashes, GIT disturbances, and convulsions. And the third one is pyrazinamide, and here you can see the structure over here. This is structurally similar to the isoniazid, and first line medication in prevention and treatment of tuberculosis, more active in acidic medium. And the mode of action, it inhibit mycolic acid synthesis, but by interacting with a different fatty acid synthetase and coding gene. And the dose is 25 mg per kg, and adverse effect are hepatotoxicity, vomiting, hypertension, nausea, and vomiting. And here you can see the next drug, ethambutol. Here you can see the structure over here of ethambutol, and this is also tuberculostatic. And mode of action over here, inhibiting arbinosyl transferase that are involved in the mycobacterium cell wall synthesis. Here you can see the cell wall, and there the small particle of arbinosyl transferase. This is an enzyme over present in the cell wall. And ethambutol inhibit the synthesis of arbinosyl transferase, and the dose is 15 mg per kg. The adverse effect are optic neuritis, that is red green color blindness, hyperuricemia, that is elevated uric acid in the body, skin rashes and joint pain. And the next drug is streptomycin. The streptomycin is also tuberculocidal and first aminoglycoside antibiotic which was isolated for the adenomycetes bacteria and several related soil microorganism. And the dose is 750 mg, less than or greater than 50-year-old, and 500 mg to 65-year-old patient. And here you can see the mechanism of action of streptomycin. Aminoglycoside bind to the specific 30S and 50S subunit ribosomal protein. The protein synthesis is inhibited by them in at least 3 ways. The first way, they block the formation of initiation 70S ribosomal and mRNA complex. They induce misreading of the code on the mRNA template, and this inhibit the translocation. And here you can see multi-drug therapy. The multi-drug therapy to treat TB means taking several different anti-tubercular drugs at the same time, or combination therapy. Drugs are combined to delay the development of resistance and to reduce toxicity or to shorten the course of treatment. Used for single drug rifampicin, use of single drug rifampicin for tuberculosis will not be affected. That's why it is used in the combination with other anti-TB drugs in multiple drug therapy. So, the drugs used most commonly to treat TB includes rifampicin, isoniazid, pyramidine, and ethambutol. WHO DOTS. The WHO World Health Organization recommended directly absorbed treatment short course, that is DOTS therapy, was launched formally as revised National TB Control Program in India since 1993 to 1996. World TB Day is celebrated on 24th March. And here you can discuss, or we can discuss the chemotherapy of tuberculosis. And thank you. Stay safe.